Ωραία, καλησπέρα και ευχαριστούμε που είστε στο Συμπόσιο της εταιρείας Proton, που είναι αποκλειστικός αντιπρόσωπος για τα συστήματα της Accuray, το Radixact και το Cybernav για ακτινοθεραπεία και ακτινοχειρουργική. Η ομιλία φυσικά είναι στα αγγλικά, so I would like to welcome Mrs. Olga Nekrasova, Product Support Manager for Accuray in the EMEA region. Olga, please give us some insight about Radixact and how artificial intelligence is helping to improve the patient care in radiotherapy treatments.
Okay, thank you very much for the introduction. Thanks organizers for giving us this opportunity to talk about our products. So Accuray is a radiation therapy manufacturer who is focusing on production of the two unique types of the Linux, Cybernav and Radixact or tomotherapy devices. So today I would like to talk a little bit more. Okay. Sorry. A little bit more on the about artificial intelligence used in our products and how it incorporates in the radiation therapy devices today. So by definition, artificial intelligence is opposed to the biological intelligence of the human beings and animals. Initially, it was designed to mimic the human behavior when you make the decisions and also during the problem solving of different tasks. So today AI influences almost all parts of our human lives and including healthcare. So we can see that more and more often artificial intelligence is used for enhancing diagnostics, evaluating treatment options for the patients, supporting clinical decision-making, and increasing clinical efficiency, and of course reducing the total cost of the treatment. There are various types of artificial intelligence options that are available today. All these algorithms are different and they are designed to solve different types of the tasks. For example, machine learning software is designed to solve the tasks, but it requires human intervention when the result of the solving the problem is not correct. And in the opposite, the deep learning algorithms are designed to work fully independently and they don't require the human intervention during the solving of particular tasks. Regarding latest publications, one of the three healthcare providers confirmed that they use some type of artificial intelligence in their routine healthcare progress. So what about radiation therapy? Radiation therapy was one of the first parts of the healthcare that adopted artificial intelligence algorithms in the routine clinical practice. So today you can see that AI algorithms are used to target and control normal tissue segmentation. They are used for treatment planning, including automated treatment planning, automated QA, and imaging registration. Some of the algorithms were developed specially to be implementing during treatment delivery, and I show you that Accuray was one of the first companies who developed such types of the algorithms specially for the treatment delivery. And of course, the AI can be used in treatment response assessment. But we need to remember that AI can give clinicians real-time analysis of the very large very large amounts of the data quantities, and good clinicians, they can make the correct choices. But unfortunately, we need to remember that if the clinician is not enough skilled, the AI can do the work instead of him. So that's why we need to be very careful when we use such types of the algorithms in the clinical practice. So this is the examples of some of our algorithms that Accuray has today incorporated in our machines. So for example, the synchrony treatment delivery option is a special algorithm that has learning capabilities and that enables us to deliver radiation therapy to the moving targets without interruption of the beam. So each time the treatment delivery is adapting to the patient and to this particular time of his breathing cycle and his condition. Also, we have some types of AI algorithms that are incorporated in our treatment planning process, such as the Vola Ultra optimization tool, and also some algorithms that help us to receive a very high quality imaging on our devices, such as ClearRT. All of these algorithms, they are different. Some of them have learning capabilities, some of them were learned on the factory, and they are locked to prevent human intervention into them and to be able to deliver safer results. So I would like to talk a little bit more about our radiation therapy machine called Radixact. So this machine is considered as a universal machine that can deliver fast, personalized, and universal treatment for all the patients and for all parts of the patient body. What is unique about the Radixact? So first of all, it's our helical type of treatment delivery, which allows us to have the largest treatment fields in the industry, up to 135 centimeters. We have the unique fastest in the industry binary MLC that allows us to have very good dose distributions with a sharp dose gradient. Also, what is unique about the Radixact system, because of its helical type of delivery, we were able to have the truly full CT that is incorporated inside of the machine that has the fan beam modality inside, which allows us to receive the highest quality of the imaging comparing to conventional Linux having only cone beam CT inside. Also, having the synchrony technology allows us to adopt our treatments online and to give the patient possibility to have free breathing, not interrupting the treatment if the patient moves, for example. Our treatment planning precision was especially developed for Accuray systems and has all the tools that are necessary for the development of the high quality treatment plan. So for example, we have the imaging registration, both rigid and deformable, using the special deformable algorithms. We have the automated contouring tools that help the clinicians to produce the contours of the organs at risk much faster and in more simple way. The plan creation itself, it's very simple and straightforward, so you can get very high quality plans less than in the few minutes, especially using our new optimizer Vola Ultra. As I said earlier, we have the synchrony algorithm that has capability to deliver the treatment beam for the moving targets without the need to interrupt the treatment or to have some breath hold restrictions on the patient. And also we have built-in QA tools that allows us to analyze how the plan was delivered and also to implement the adaptive delivery inside the machine. So a little bit more about Vola Ultra, so why it is very important to continue developing the software. So using this new optimizer, we found out that the optimization time was reduced more than 90%, and up to 60% the beam on time was also reduced. So it means that the quality of the plans and that the medical physicists can achieve in the less time, they actually increased, and it gives them the possibility to analyze more options and to choose the better suitable plan for the patient. So why Radixact? Radixact system provides us the confidence in the treatment planning and treatment delivery. So by using the integrated helical fan beam option, you can receive the highest quality of the images that can be further used for treatment replanning and treatment evaluation, and real-time synchronization of the treatment delivery allows us to have better clinical outcomes for the patient. So what is ClearRT helical fan beam CT capabilities? So first of all, it's the largest field of view for such types of the imaging devices on radiation therapy machines. So we have up to 50 centimeters field of view. Also, it allows us to have the longest imaging field for the radiation therapy devices, that is 135 centimeters, and for example, the imaging time is relatively very small. You can have 1 meter of the image only in 1 minute. So it's, for the treatment delivery machines, it's quite impressive. And also, why we have such good quality of the images that we receive from these technologies, because we can have the high fidelity images, meaning that because the thickness of the fan beam is relatively small to the traditional cone beam CT, so it allows us to receive and to reconstruct the images in the highest quality. So here you can see on the left side are the images received on the ClearRT machine, and on the right side the images received on traditional CBCT. So you can see that there is much less artifacts. The image itself has much more uniformity, and actually it can provide us much more details on the patient anatomy. That's why such types of these images can be used for the treatment replanning and adaptive treatment delivery. So if you don't get the enough quality of the image on the patient during his positioning, for the real adaptive treatment delivery, you will need to make the separate scanning on the traditional imaging devices. Otherwise, when you use the CBCT on computing, you will have to incorporate the errors that will occur because the quality of the image is not that good. And finally, it may result that your plan is not accurate anymore. So how we do the adaptive treatment delivery? So we have the automated adaptive option called Precise Art, which actually allows us to receive all the imaging data that is received during patient positioning, so you don't need to have any additional imaging. So the system automatically incorporates these everyday images. It deforms the initial structures that were for the initial plan, then it recalculates the plan on the new anatomy that you received today, and you can see in real time the changes of the dose delivery for the critical structures for your target. And if, for example, these changes exceed some limitations that you already have set up in the system, then the system will automatically notify the clinicians, the medical physicists, and they will be able to make a decision whether they use the new treatment plan or they continue to use the old treatment plan, and everything is going as planned. So the synchrony technology allows us to have and to receive no trade-off radiation therapy. So what it means? First of all, it is very convenient for the patient. So during treatments of the moving targets, normally we need to control the movement of the target. We need to restrict the patient. Sometimes we do the breath hold. Sometimes we use some special fixation devices that are not really convenient for some of the patients because of the very poor condition. So that's why we introduced this technology first on the CyberKnife system, and then it was adopted for the Radixact. So it allows the patient to lay normally on the treatment couch without any special fixation devices, without any special restrictions on his breathing pattern, and the system itself will adopt the treatment delivery to the way the patient behaves. And also this allows us to minimize the margins that we need to put on the moving targets, because every time we know where the target is, and we can irradiate only the target and not the critical structures. So, and all of this allows us to have efficient continuous delivery without beam interrupting, which gives us the possibility to treat the patient in the same time frame as without any breathing techniques. So how we can make the synchrony technology available on the Radixact? So first of all, we have the moving primary jaws of the collimator, which can adapt to the moving of the targets, so they can compensate up to 2.5 centimeters of the moving of the target. So for most of the targets located in the lungs, it's more than enough. Plus our MLC that has the open and close time of only 20 milliseconds is much more than enough to incorporate for the movement of the target with the breath, because the breath is a relatively slow process. So how the plans look with and without synchrony? So to the left you can see the standard ITV-based plan for the target that is located in the lungs. So you can see that the dose and the PTV contours are pretty large because the target has intention to move. But using the synchrony, we were able to reduce the PTV margins that we apply to the target. We were able to have much more compact dose. It means that the dose for the critical structures will be decreased more than 70%. So how it looks in reality? So the red is the treatment beam, and the blue is actually the X-ray imaging that is taken during the treatment delivery. So you don't need to stop the treatment delivery beam to receive the new images. It allows us to have the adoption of the treatment delivery and to adopt our treatment delivery algorithm real time, so you don't need to stop the machine to do any imaging. So also the patient has LED markers that are placed on the patient chest, and we have special external camera that monitors the movement of the patient chest, giving us even more information about the movement of the target and the position of the target in each moment of the time. So again, why to choose Radixact system? It allows us to have precisely treatment for all types of indications in the human body, and the helical type of delivery allows us to have much better and much more complex dose distribution for the targets in any part of the human body. So here are some typical examples where the Radixact treatment can be used. So you can see that you can use this machine basically for everywhere, including intracranial, lung, breast, spine, and what is more important, you also can have total bone marrow irradiation only in one field, for example, because normally in traditional Linux you need to have multiple fields, you need to combine them, there will be field junctions, but with the Radixact system, with our treatment delivery length of the field, you don't need to have such complex procedures. So here are some examples how the Radixact is used in different centers across the world. So you can see that almost any types of indications are treated. So it's a totally universal machine, and each center can decide how to use it and how to bring much more confidence in their clinical practice. So as a recap, we can say that Radixact can be incorporated in every radiation therapy department using our IDMS data management system. You can have adaptive treatments on daily basis without need to involve any additional specialist or any additional imaging. You can have real-time adaptive treatment delivery with the synchrony option. And of course you can get the highest quality images during patient positioning with our ClearRT options. So thank you for attention. Any questions?
Yes, thank you very much, Olga, for the insightful presentation in these 20 minutes. We have some time for some questions on any of the subject covered. Okay, in the meantime, until maybe somebody thinks of something, may I ask you, you showed the synchrony.
Mm-hmm.
Okay, it removes all the, you have no intervention during the beam on time, but you have still some effort to create the model before the beam on time for every patient, right? What's an estimate?
So
how
we do it. So actually, when the patient is put, so when you do the initial positioning of the patient, you do the imaging, so you adjust the position of the treatment table, and during this time, once the table is adjusted to the planned position, the system takes the first set of the images, and using this first set of the images, it creates a correlation model between the movement of LED markers that we place inside, on the surface of the chest and the movement of the internal target that we can see on the X-ray images that we get from our imaging device. So we can combine these two sets of the data and update them during the treatment delivery.
Okay. And about the imaging of the internal organs, do you need fiducial markers, or is it something, how does it work?
It depends on the localization. So, for example, for the lung, we have the option that does not require the use of the fiducials, but for the prostate, you need to implant fiducial, and also for the liver, for the pancreas. So our system, it detects the fiducials that can be seen on the X-ray images, and it creates the model using the position of these fiducials.
Okay. But for the lung, you can still go without the markers and use it. And it actually uses like two perpendicular imaging every time for the model for each.
For the Radixact, actually, you define the angles of the images during the patient preparation. So the clinicians, they can choose different angles depending on the localization of the target. And it's slightly different for the CyberKnife, because for the CyberKnife we have the fixed X-ray images, and you already can't change the angles. But for the Radixact, because the system is rotating, you are free to choose any more suitable angle where you can see the target better.
Okay. And I think I have time for one more question. Do you currently have or are you working on any SGRT approach, a surface-guided approach?
Yes, so we are collaborating with CRAD on this matter.
But it's still in progress, okay.
No, it's available, so
it is available.
The system is integrated
okay,
already.
okay. So you also have this option for breast or superficial tumor?
Yeah.
Okay, good. I think, is there any question from, okay. Then thank you again, Olga, very much.
Thank you.
Ευχαριστούμε και την εταιρεία.